It is a new year, a perfect time to start fresh and focus on our health and well-being. So with us today to share ways to help you and your family have a healthy 2026 is Dr. John Redding with Cone Health Primary Care at the MedCenter in Asheboro. All right, let's first and foremost talk about what's the #1 item that should be on everyone's checklist.
Thinking about getting a good annual wellness exam with their preferred primary care provider.
Yeah, and sometimes that can be a little difficult because sometimes people don't have a primary. So what kind of recommendations can you give us to how we can get one of those ones? What's the best way to look for one?
Well, there's any number of ways that folks can obviously talk to family and friends. Cone has a website, conehealth.com/primary care, that could also be useful. And so just one of the resources available for folks to consider.
Yeah, I know years and years ago, it was hard to get a primary caregiver because people weren't taking new patients, but now that seems to have lessened. So we need to check those websites again and see who's got some space available for us. Let's talk about some of the health screenings and tests that we should be talking about with that new provider when we get them.
Well, the annual physical or annual wellness exam is an ideal opportunity for us as providers to really get to know our patients, which is invaluable in high quality care. Obviously, it'll depend on the age of the patient, the individual needs. From our standpoint, when we get into a wellness exam, we're going to go through the past medical history, which in some cases, especially with older folks, can be extensive and it requires a good bit of study. But once we get to know that situation better, it can be invaluable in focusing on the things that are especially important. We're going to go down the med list with a fine-tooth comb. We're going to get into lots of information about their close blood relatives that are going to be important. We're going to eventually, at the appropriate time, check labs, get an idea about all sorts of things related to cholesterol, blood sugar, prostate cancer screening in men, and the list goes on. Might want to get into some colon cancer screening, incredibly important. And also breast cancer screening. When was the last time a particular woman had a pap smear? All those kinds of incredibly important cancer screening things that have to be addressed periodically.
And just because you look at someone and they look healthy or they feel okay doesn't mean that everything's okay. You actually have to do some of those screenings in those labs.
You got it. It's actually pretty common to see a relatively young, healthy person with real problems as far as cholesterol or blood sugar, and they don't necessarily realize it. And the other one that's really sticks out is blood pressure, typically in adults. There's a reason they call blood pressure the silent killer. There's a lot of folks out there with poor blood pressures who don't realize it. There are people who feel poorly with elevated blood pressures, but a lot of folks don't. And that's one of the best examples of something sneaky that can be certainly picked up in a wellness exam.
You think to yourself, I feel great and I look fine. Nope, you need to go see the doctor. All right, so in addition to those health screenings that you just mentioned, let's talk about some vaccines and some other things that we need to make sure that we're up to date on.
You bet. Vaccines are very important from our standpoint. Obviously, everybody has to be taken individually. There are some folks that just can't handle certain vaccines, but in our experience, these vaccines are very important for the vast majority of folks. Obviously, a lot of folks need their flu shot in the fall. We also want to focus on things like the pneumonia vaccine. We see a lot of pneumonia, mostly in adults, but sometimes in children as well. And certainly we can significantly reduce the risk of getting it, as well as if they do get it, reduce the very significant risk of hospitalization or worse. And so those vaccines are incredibly important. Obviously, COVID boosters, and there's just a pretty long list of other possible vaccines depending on who the patient is, what their specific needs are, et cetera, et cetera. And certainly advocate that in the vast majority of folks.
Sure. Okay, so we talked a lot about our health, as in our physical health. Let's talk a little bit about our mental well-being as well. What steps should we be taking when it comes to taking care of our mental health?
Mental health, we do depression screenings fairly commonly here so that we're looking for it, even if it's not something that you necessarily are immediately comfortable speaking to the provider about. We also want to see how you're sleeping. We want to talk about sometimes dynamics within the family, if you will. And then that also goes back to the social history. How are things going in the realm of tobacco and alcohol? Obviously, alcohol can be a very significant depressant in some folks and is clearly a bad idea for some folks, and it will certainly mess up your sleep cycle. So all that, will be covered.
All right, so when it comes to our eating habits, this is definitely something that's on a lot of people's radar this time of year. What should we focus on? What steps can we start taking today?
Well, I really feel like that most of the data continues to point towards a high vegetable diet. And I think most of us indulged a bit over the holidays. I know I did. And it's time to get back on track as far as cutting back on the carbs and going with lean meats, hopefully reducing fat intake. And things of that nature. For those of us who wanted to get into a little bit more detail, there's an app that you can download called My Plate. That's one word, My Plate, that is recommended by some of my mentors and I think is helpful. But a lot of the scenarios, people tend to know in a lot of cases what's healthy and what's not, but they certainly can get guidance from that. And I think the attitude should be progress, not perfection. Chances are your primary care provider cheated some too. I know I did.
I like that. Progress, not perfection, because that I think when January 1st rolls around, we say we're never going to eat this again, or we're never going to drink this again, or we're never going to do this activity again. And it's so easy to kind of like fall off of that instead of saying, hey, I'm just going to limit this a little bit.
You got it.
All right, so let's talk about exercise. That's another one that a lot of people this time of year say, I'm either going to start or I'm going to stop or I'm going to do more of.
Well, that's near and dear to my heart because that's one of my saving graces. I like to eat just like everybody else, but I do exercise pretty regularly. I think relatively low impact aerobic exercise is a great way to go, which means somewhat vigorous walking. My wife and I enjoy cycling in greenways. And if you're into it and you have the appropriate facility, swimming is wonderful, and there are indoor swimming pools around here. So all those things are wonderful ways to burn calories and maybe allow a little bit more freedom at the dinner table. And so I think that's huge. The national recommendations is about 150 minutes a week. That's a lot. I don't accomplish that every week. But I certainly do take a good stab at it. And if it's my day off and it's a decent day, I'm going to be exercising. I also have it set up where there's a stationary cycle in our basement, and you got to make it fun. I want a football game on the flat screen. I want some good music. You can't just go into a dark room and expect to get but so motivated. You have to have some stimulation. You have to make it fun.
Yeah, I like the idea of being able to watch the game while cycling or walking on the treadmill because you're just sitting there anyway, right?
That's right. And there are times where I don't feel like leaving the house if the weather's rotten.
Sure. All right, so how can people use technology? Maybe they got an app, a wearable device, or something like that over Christmas.
Um, there are a few technology things that I have in mind, but I'm not going to pretend to be a whiz at that. One of the things that I use a lot is the pedometer on my cell phone when I'm out there walking hard, and you feel like that you've done a reasonable job and distance. Well, let's check that pedometer and see how you really have done. Have you gone 2 miles or 4 miles? Keep yourself honest in that regard. We already mentioned the app regarding food and whatnot. And I'm sure there are other things out there. And I suggest people ask their friends and their own primary care providers because there's probably a few tricks out there on the computer that I don't know about.
Sure. All right. Well, we have about a minute left. Any final thoughts or things that should be on our health checklist that maybe we haven't talked about?
I think the key things are find a good primary care doctor that you identify with, get at least big ticket screening done for major common cancers. Focus on the big stuff first. Progress, not perfection, and have fun with it.
Have fun with it. If only we can. That's a good attitude to have. All right, thanks, Dr. Redding. We appreciate this. If you missed any of this, maybe you need to send it to a family member or a friend. It's going to be in the To Your Well-Being section of our website.